So you probably heard about cortisone shots for knee osteoarthritis. But what about platelet-rich plasma injections? This is a completely different approach where the injection is focused on long-term healing rather than a short-term fix. So let's watch a small clip from my YouTube video where I delve into this further. Other ways to change the biology of the joint, thereby there's less ongoing inflammation and more healing of the joint. So this is where PRP or the platelet-rich plasma comes in. So the PRP is made from a patient's own blood, which is centrifuged to concentrate the platelets and leukocytes. The platelets are rich in components like growth factors, serotonin, and ADP, and they all help aid in healing tissues. The studies show that the platelet concentration should be at least 5 times the baseline. The biggest problem that we have is that we don't have a standardized PRP concentration yet that can achieve consistent clinical results. In addition to that, the PRP centrifugation machines can be so much different. So for example, not all centrifugation machines can provide the optimal concentration of platelets that can provide a good clinical healing. So for example, let us say I'm going to administer a cortisone injection to 10 of my patients. On all 10 of my patients, I'm going to administer the same medication dose. So which means that there is a good consistency among the treatment that I'm providing. However, with PRP, it's going to be a lot different. And again, it is based on the patient's baseline platelet count. In addition to that, there is also a variability in the machine that can provide the platelet concentration. In addition to that, the plasma not only contains platelets, but they also contains leukocytes, which is also called as the white blood cells. We just don't know whether the leukocytes also helps in healing for osteoarthritis or not. At least for knee osteoarthritis, we have come to a consensus that leukocytes should not be in the platelet-rich plasma. However, there's still an ongoing controversy whether the leukocytes can actually be helpful in knee osteoarthritis. So what we understand is that PRP can work by controlling inflammation, and they can attract growth factors that promote stopping the destruction of the joint and thus slowing the progression of osteoarthritis. While there is not yet definitive evidence that PRP can regrow cartilage in humans, it has been shown to decrease catabolic factors, basically the factors that degrade cartilage and bones, which can cause worsening of osteoarthritis. So as you can see, the platelet-rich plasma injections is a powerful tool that uses your own biology to promote healing. But here's one big caveat with these injections. These injections are not covered by insurance, and depending on the clinic, they can run anywhere between $500 to $2,000. But again, one can see that as an investment into that long-term joint health. Okay, so this was part 2 of my knee injection series that we talked about. So follow me to know about viscosupplementation injections, which I'm going to cover in part 3 in my next video.